Hello, I'm Dr. Crockett, and this is Dr. Sanders with Zeal Integrated Health. And this month is Women's History Month. And I think it's important, I think back just in women's history, and I remember writing a book report back, I think it was the fourth grade, on Eleanor Roosevelt. And, I think it's important to point out, these important people that have impacted our lives. And we all have women that have changed our course in our life. We can look at our grandmothers, our mothers, my amazing wife, and how she just helps to keep me in line and the kids in line and run our family. She runs, the business of the family. And I think she can do that, and she can still go out there and be a pediatric nurse and carry on a job. It's just amazing, what women do throughout our country. And I think just to point out, the earliest known female physician lived in Egypt almost 6,000 years ago. Women have been involved in healthcare throughout the ages. And today, I think it's important to understand that, women typically live 5 years longer than men, and they make up over 5 million, I think, more individuals in our general population than men. So today, I want to spend a little time just focusing on common health concerns that we see in our female patients in the chiropractic clinic. So let's talk a little bit about what we see, Dr. Sanders.
Well, with that extra 5 years on this earth, we tend to see some more of the diseases prone later in life, one of those being osteoporosis, so the thinning of the bone. We see that almost 4 times more likely in women. Scoliosis, we deal with that a lot here in the clinic, and women are actually 10 times more likely to have scoliosis above the age of 10. Shoulder complaints and other joint laxities like the knee, those happen a lot because women's joints tend to be more lax, especially after pregnancy. Foot and ankle problems do occur quite a bit, mostly because the choice of footwear, but also partly due because women tend to have a smaller hind foot, and that tends for more pronation and more stress on the ankles, which can also cause stress on the hips and low back as well.
You bet. So I think it's important to catch these things early on. If we look at osteoporosis, typically we start seeing people get scans done around the age of 50. But I think even before that, it's important to be looking at your calcium levels. The amount of vitamin D is extremely important to identify if you're putting yourself at risk for developing osteoporosis. Scoliosis, we recommend that you're checking, that children between the ages of 13 and 18 are getting evaluated to see if they have scoliosis. And then when we start looking at some of these things like the feet and ankles and just the stress that's put on them, well, sometimes just getting what we would do is an A-line scan, and we check the alignment of the hips to the knees to the ankles, and sometimes just doing a foot orthotic in there to support that alignment can prevent degeneration over the years and really keep somebody from developing some of those issues as far as arthritis in the foot. So it's important to identify these things early on. And I just want to say that we appreciate what women do in our country and what they do throughout history, but we want you to stay healthy while you're doing it. So it's important to make sure that you're focusing on your health so that you can be there for yourself, you can be there for those family members and the career that you've chosen, the path that you've chosen, and we look forward to working with you in the clinic.